So welcome everybody. My name is Shefali Jain. I've been part of the CKSTEM family since its inception, and I'm very happy to be able to bring this wonderful opportunity, this information session. And this wouldn't have been possible without our leader, Ms. Jagrup, and our wonderful team of volunteers. I would get into the detail of introducing them to you as well. But to begin with, what is Competitive Kids STEM? We are a non-profit organization, a community of like-minded people, as Ms. J said. And our team is comprised of industry experts, educators, and parents who want to bring about a change and enhance kids' education. Especially, our purpose really is to enhance your education from an elementary school to high school perspective in the interdisciplinary approach of STEM, which stands for science, technology, engineering, and math. A unique feature of our organization is that not only we provide you with continuous coaching, training, we also guide you for competitions at a local, provincial, national, and international level. Our philosophy is very simple. We encourage and guide you in a very holistic and interdisciplinary approach, as I mentioned. We also like to or endeavor to build leaders from a young age and have the young talent get developed. Without further ado, some key guidelines for our session this evening. We do have a Google form that we have created to collect your questions that you may want to put to our experts. And I can see our experts are slowly joining us. So a warm welcome to our experts as well. Now, Anika, if you can share the Google link, sometimes when you share in the past and the new additions cannot see, if you can once again share the link for the Google form, that would be great. Now, the chat is restricted because we have a larger number of audiences. However, you are able to chat with the host and the co-host in case if you have any issues. The audio and the video for our participants would remain turned off so that the quality of the call does not deteriorate. We would request our speakers and our volunteers to switch on their videos when they are presenting and they are talking to you so that you can see them, get to know them as well as to who they are. And once again, we will have a question and answer session with our experts. And the Google form that I talked about would remain open even after the session. So at the end, if you think of, a question that you wanted to ask, but there is no longer an opportunity, you don't have to worry. You can always fill out the form at a later date as well, and we will email the answers back to you. That brings me to my next question as to how do you fill out the form? It's very simple. The URL has been shared again, and it doesn't mean that you only get to fill the form once. If you have more than one question, you can fill out the form as many number of times as you want, right? And now moving on to the key people behind this opportunity, meeting the FHP, the Future Healthcare Professional team. So if I can request our team members to switch on their videos as well, that would be great so that you guys get an opportunity to see them as well and get to know them. To begin with, this would not have been possible without the stewardship of our lead, Miss Jagrup Randhawa, our program lead. So Miss J, can we have you say something about yourself, please?
Absolutely, Shefali. Thank you so much for introducing me. First of all, I would like to thank CKSTEM actually giving me this platform. I always wanted to do something for community, not only for my kids. I think this was my dream to do for others as well. So I'm so grateful for all of you to give me this opportunity so that if I can help anybody to maybe get their dream jobs or what they plan in the future, that is a blessing for me. So myself, Jagrup Randhawa, I'm a dentist back home. worked as a dentist for 5 years in India, in Amritsar, and then I moved to Canada. I've been teaching dental and medical courses for the last 10 years, almost 10 years, more than that. Right now, I'm teaching at Maddox College Dental and Medical courses, and I'm also teaching at George Brown College as a dental professor there. So thank you, Shefali. Back to you.
Thank you, Ms. J, and we look forward to hearing more from you. And now moving on to introduce our wonderful team of volunteers, starting with Ms. Anika Agarwal.
Hi, everyone. I hope you can put a face to the name you've been seeing in the chat now. I am Anika, and I am currently a grade 12 student at Central Peel Secondary School. I have personally been a part of HOSA for the past 3 years, ever since 9th grade, and I really love it, and I'm so excited to work with all of you in the coming months.
Thank you so much, Anika. Moving on to our another volunteer, Ms. Komal Vachani. Hi, Komal. Can we hear from you?
Yes, sorry, there were some complications. Hi, everyone. I'm Komal. I'm also a grade 12 student at Central Peel Secondary School. Something that got me really excited and invested in this program is taking grade 11 and 12 bio over the summer. And I hope this program will help me decide what exactly I want to go into. So I'm kind of leaning both ways with engineering and medicine. So hopefully, if you don't have your stuff figured out, that's fine. Hopefully this program helps you as well. So really excited to work with everyone.
Oh, thank you, Komal. We are looking forward to you working with you as well. And now moving on to the third person of our triad, last but not the least, Ms. Supreet Bains. Supreet, can we hear from you?
Thank you, Shefali. Hello, everyone. This is Supreet. I'm from grade 12 as well, from David Suzuki Secondary School. And I have done last year HOSA. And that made me think about joining this program and exploring my own career options, as well as helping other people to explore their career options. Thank you. I'm very excited.
Thank you so much. Yes, we are looking forward as well, Supreet. Thank you so much. And now back to the captain of this ship, Ms. J. Ms. J, the floor is yours. Ms. J, you seem to have been muted.
Yes, thank you, Shefali. Do you hear me now?
Loud and clear, Ms. J.
Okay, thank you. All right, so I promise you that today's evening is going to be fun. This is our agenda for today. We are going to talk about what is FHP, Future Healthcare Professionals. We are also going to discuss who can join it or who should join it. As I said earlier, 9 to 12 graders. So we are going to talk in more detail. And as you might have seen that in the posters as well, we do have the industry experts. We have doctors here, the guest panel, and of course, they are going to address some of the questions we asked them. And at the end of the session, you can ask them any questions too if you have. Then we will be discussing how you can register for this program, which is Future Healthcare Professional Program, starting from October 13. And we are going to discuss that in more detail later. We will also talk about learning management system, which is basically that once you register for that program, how you will be evaluated, or where would you see the content we are sharing with you, or your assignments, or the assessment we do. So that part will be discussed too. And then the last but not the least, we are also going to talk about HOSA, which is, I think, a big thing for 9 to 12 graders. Many of you might already know that if you are already participating. So we will prepare you for HOSA in these classes, which we are offering starting from October 13. So to begin with, what is FHP, Future Healthcare Professionals? This is for students who are in grade 9 to 12, and if they are interested in biology. Many of you might be thinking sometimes when we go to the hospital, oh, I want to work in the hospital too. maybe working as a doctor, working as a nurse, working in the pharmacy, working in the lab, right? So if that is your dream, I think this program is for you. If you see yourself fitting in the healthcare anytime, maybe you might have even dreamt about it, I think this is for you, so that you can see if you are the right fit or not. And I also see that, as Komal said, that she's not sure if this is the right fit for her. I think this program is for everyone who is not decided yet that if you want to go for future healthcare professions, or if this is the time for you to change, if you want to go in another profession. So if you think that the body, how it works, or the biology concepts, those parts interest you, this program is for you. Who should join? If you're if you're interested in biology or health career, anytime, if you might have seen, I still remember when I was young, and when I used to go to hospitals, seeing doctors working there or surgeons doing surgeries, I always thought, oh, I wish I could be here. And I enjoyed, when I was the dentist, I enjoyed the surgery part the most, right? So if you're interested in health careers or biology, here you go. If you want to be the future lifesaver, if you see yourself, you're helping a patient, or if you see doctors when they're prescribing the medications, or you're even maybe taking care of the grandparents, you wish sometimes that I wish I can maybe treat my grandmother, grandfather, this program is for you. If you're preparing for university, if you're planning to take majors in health sciences, but still it is not very clear in your mind that if you want to go in this path or not, go for this program, because we will help you to understand that what it will be once you get into the healthcare professions. If you want to improve your problem solving skills, because most of the assignments we are going to give you are based on, those will be the scenario based assignments, assessments. You will be working in teams as well. One of the Hosa team event is it's a dental sciences team event, in which you will be taking impressions on each other. You will be disinfecting the dental units, sterilizing the instruments, autoclaving the instruments. So as I told you that I work at Medics College, I'm teaching the dental programs here. So I spoke to my director of education, and I got the permission that I'm going to take some of the students from this program and showing them those clinical skills. So we are going to help you to develop those clinical skills as well. If you see yourself going for the competitions at different levels, regional level, national level, or international level, this is where you should be. So what you see in this program, we are going to start this program from October 13 for 16 sessions every Tuesday. So this class is going to be once a week for 90 minutes, starting from 5:30 to 7. Due to COVID-19, I think we all are scared of going out. So that's why we are bringing these classes to you at home. So these classes are going to be online. Some more benefits. You will understand the biological concepts, how your body works, your body systems, such as digestive system, nervous system. Many of you at this age, you might be thinking, oh, how my brain works. How do I think? What happens to the food when I eat? So this is what we are going to discuss in all those classes, the 16 sessions, different body systems. How do the body systems work? What is the anatomy and what is the physiology? And we will also help you to develop the leadership skills. As I said, you will be participating in the team events as well. This is what we are going to prepare you. Biology classes for grade 9 to 12. Hosa, the competition. Brain Bee is another competition, which is more on neurosciences. So we are going to prepare you for that as well. We do have 2 other competitions where we are going to take our students to. One is NBC, another one is CBO, National Biology Competition. And Canadian Biology Olympiad. So these are all 5 competitions we are going to prepare you along with teaching you grade 9 to 12 biology. And then I'm very excited to introduce the guest panel here. Okay. First of all, I would like to thank all my doctors here, industry experts here. Thank you so much for joining us today. On behalf of CKSTEM, I really thank all of you, and I welcome you all. Especially in this season, I know that you all are very busy, but thank you so much for making it happen. It was not possible without you all. So my first guest speaker I have here is Dr. Bipan Shah. Bipan is my colleague. We work together at Medics College. I teach their dental programs and Bipan teaches their pharmacy. He is an anesthetologist from USA. He completed MBBS from India, and he's also working at Mount Sinai Hospital right now. Bipan, can we have you here? One minute, let me just check if Bipan joined us.
Yes, I'm here.
Okay, thank you, Bipan. And I'm sorry, I have to go back. Okay, thank you, Bipan, for joining us today. So if you can please shed some light on some of the questions you see on the slides. But before I ask Bipan to join audience, I will just remind you, if you can please fill up the questions in the Google form as Shefali mentioned earlier, because now while Bipan is talking, if you have any question in your mind, it's better to write it down now, because sometimes then later on we forget, right? So it's just a reminder, if you can take the notes and write the questions and fill it up. Okay, thank you. Bipan, this is yours now.
Thank you. Thanks, Group. Hi, guys. My name is Bipan, and right now working in Mount Sinai Hospital, at the same time teaching at Medics and teaching pharmacy programs. Now, you might be wondering, like, what happened to me? Like, if I was a doctor, did my anesthesia, and then all of a sudden went to a pharmacy. Anyway, it's fun. It's really phenomenal. Pharmacy is such a field, where you can help people. You can see people are getting better. At the same time, I always used to wonder why, what does drug do to the body? And I always used to think that, okay, let's say if I have a headache, and then if I take medication, is it gonna go into my head and it's gonna get better? Or is it gonna do something about it? So always I used to wonder, what does drug to the body, and why such a small tablet can help somebody taking care of the blood pressure, taking care of diabetes, cholesterol, and whatnot. Anyway, so to help people at the same time, what does drug do to the body? That I wanted to know. That's why I chose pharmacy. What do you like in your field? The typical day in my field is meeting with clients, meeting with patients, hearing about their concerns, hearing about their complaints, and then you just guide them for the proper medications, or proper or encouraging them whatever is available over the counter. And obviously you work with the doctors at the same time, in collaborating with the doctors and everything, you come to a pharmaceutical care, and again, end result, you want to see the best care for the clients or for the patient. So at the end, you are tired, but at the same time, you are satisfied that you help people. And again, money is also a good thing. There's money also in the field also. Okay, what would you recommend to people? Why would you, or what would you recommend to prepare for a career in pharmacy? Well, definitely pharmacy is the field. Like, let's say if you want to help people, if you want to help your community, at the same time, if you want to know what drugs can do to the body, and if you want to make money in this country. So anyway, that's why I chose this particular career in pharmacy. Any questions, anybody? Sorry, I'm in rush kind of thing because I'm teaching right now. So I'm in the middle of teaching, so that's why I had to rush in a little bit.
No, thank you so much, Ben. Actually, questions we were taking at the last. So what we ask our audience to fill up the forms, and if there is any question which we are not able to answer, maybe I will bring those questions to you. Thank you so much joining us, Bipan.
No problem. Good luck. Bye.
Thank you. And then I have my friend here, Dr. Seerat Sachar. I know Seerat, you're very busy. Thank you so much for making it happen today. She's very busy in her professional life as well as personal because her 1.5-year-old is keeping her busy all the time. So Seerat is MD in internal medicine. She's working as associate staff at Division of Internal Medicine, South Lake Regional Health Center, Newmarket. She completed MBBS and MD radiology from India, and she did MD internal medicine from Detroit Medical Center, Michigan. Once again, thank you, Seerat, for joining us today. And I do have some topic of discussions. If you can please help our kids to decide if this is their field where they want to go. Thank you, Seerat. Seerat, are you there? Oh, I think Seerat cannot unmute herself. So Anika, you need to help her to unmute.
I don't see her in the participant list. Can you just text me?
Anika, it says Sarabjit iPhone.
Ah, okay. I got it.
Yeah, thank you. Thank you.
Hi, thank you. Sorry about that little glitch.
No worries. Thank you, Seerat, for joining us today.
I was trying to unmute for a little while there, but it didn't work for me. I hope you can all hear me now and maybe see me as well.
Yes, we do.
Okay. Well, I first of all want to thank CKSTEM. I'm relatively new to this program, but I kind of like the feel of what I'm getting so far. Now, I won't take too much of your time, and I would just stick to the questions that were put across to me. So as Jagrup mentioned, I work as an internist at South Lake Regional Health Center in Newmarket. So my typical work is one of a hospitalist, which is to say that I take care of inpatients that are admitted to the medicine service with varied kind of medical problems. So on any given day, we see about 20 to 30 inpatients. And on a weekend, we might see up to 35 to 50 admitted patients in the hospital. And again, starting off in the morning, it is no longer the doctor who works alone taking care of a patient like in the movies. He's not the hero there. So it's more of a team approach. And we start off the morning with bullet rounds where you kind of discuss the patients with your allied health staff, which includes our physiotherapists, occupational therapists, pharmacists, and social workers, discharge planners, even dietitians, and so on and so forth. So, initially we go quickly over every patient's problem list, and essentially, in a hospital, it's more what stands in the way of a discharge. So what are the steps we are taking? How well is the patient doing? What are the pending investigations? What consults are pending? Because, you're not doing this alone. You do talk to other specialists about some of the problems that the patients have. And then you kind of go over all that quickly in half an hour, I would say. Again, when you enter the hospital, you might, or even before you enter the hospital, you might be paged for some sort of a problem that you can deal with on the phone or in person. A patient might be crashing, so you just might have to skip the rounds and go straight to see that patient. So it's not, I wouldn't say that it's always predictable, but more or less you start with the rounds, then you go see your patients, you do what is required for them. And then again, there might be some family meetings to discuss things about a patient's management with the patient as well as the family. In between, you might have your teaching rounds, you go to your educational rounds or your administrative meetings. So kind of the day just kind of keeps on going. And all this is kind of interspersed with pages that you answer from various members of the team that have questions about a patient's care, medications, other things. And then I would say you kind of don't really get the time to sit and think too much with the kind of patient loads we have right now. So that's my typical day. Again, as a hospitalist, you'll be the most responsible physician. So you are talking to, like, you are responsible for coordinating the care of a patient. So you might be talking to other consultants, surgeons, orthopedicians, cancer specialists, or even radiologists about a patient's plan of care. So I kind of tried to give you an overview. I would love to have some people come and observe me in the hospital if that helps you make up your minds. And then I guess I'll go on to the next question, which was, what would you recommend to prepare for a career in medicine? I suppose there are a few things that become very important. One is having an interest in constantly learning or craving to gain more knowledge, because this is a field where you cannot stop. You have to learn all your life. It's challenging, but it's very stimulating at the same time. Again, be prepared for a lot of hard work, long hours. You need to persevere. You have to take it in your stride that others might be having fun while you'll have to put in your sweat. So be prepared for the residency days, and then even afterwards you might have longer hours than a lot of other professions. So that's the realistic view. But again, other qualities that might help you are an ability to admit that you may not be right always. You might have to rethink your plans. You learn a lot from your allied staff, not only your professors and teachers in medicine, but the nurses around you, the pharmacists, other people that you work with can teach you a lot. So you should always have an open mind. And again, I think one of the most important qualities in a doctor is always humility. You're constantly learning, you may be wrong, and you have to understand that you got this privilege to make life-altering changes in people's lives. So you have to be humble about that. And that, I believe, is kind of what, in my opinion, are important things. Then J Group, I don't see a couple of other questions that I was sent earlier, so I'm not sure if it's because we're short of time.
No, see that because we were not able to actually have all the questions on this slide. So
Okay.
you can talk about all the questions I sent you. That will be great.
Okay. There was a question which kind of said how I chose my pre-med program and or medical school and why. So my path or my career trajectory was a little different from what kids here might be doing, because I'm a graduate from India. So I did my MBBS and MD in India in radiology, and then I took my US MLEs, and I did a residency in the States. And the way I chose my program, of course, it had to be IMG friendly. I was looking for a H-1B visa at the time. I was looking for a program which was a university-based program, and Wayne State University offered me quite a varied exposure, a lot of clinical scenarios. There were 4 or 5 hospitals on site, including a VA and a cancer institute. So I would suggest when students are looking into programs, try to get something that will enhance your knowledge in all the fields. Like a lot of community-based programs are good as well. However, with the university programs and the downtown programs, you end up seeing patients with multitude of problems, and then that helps you in your future practice. So for me, I had to be in the northeastern part of the country, again, H-1B and those sort of things. So that kind of, I had to figure out. Again, if someone wants to talk to me, I can go over some of the things for US families and how you go through the matching program in detail, maybe one-to-one. Again, there, go ahead.
That would be great help. But right now, the students we have, they are from grade 9 to 12. So they need more help in choosing the career right now.
Sure. So for that, I think a very good way is to kind of do the observerships, because you get to go to the places that you want to work in and you see the day-to-day life. And sometimes there are things that might put you off totally and you might want to do something different. So I think that's a good way to go. And again, come with all the questions that you've got. There was another question about what I'd like or dislike about my career. So I don't know, from the perspective of 14 to 18-year-olds, what I like is that, when someone walks up to you or sends you a card and says that you made a change in their life, or you're having a really frustrating day, you walk into a room and an 80-year-old says, his face lights up with a smile, and they tell you that, oh, I was waiting for you. I like this part of the day when you come and talk to me. So that for me is very, very satisfying. That's what I like about this profession, dealing with the people and being able to help them. Dislikes, well, I think increasingly we're doing a lot of paperwork, a lot of forms. So the patient interaction is kind of going down a little bit. And I think management could do a better job of that. The doctors stick to their job and don't have to worry about all the other stuff. So that's kind of one of my pet peeves.
Okay, thank you so much, Sirat. And
Most
quick
welcome.
question before you leave us.
Mm-hmm.
In this pandemic situation right now, I think as parent, even myself, we are really, really worried and scared that should we send our kids back to school or should we switch it to online? So what do you recommend, Sirat?
That's a hard question and there's no easy answer. Personally, I would say I have a 1.5-year-old and it was a tough choice for us. I did not send her to the daycare just yet because I wanted to see how things go. Again, there are two ways to think about it. We're talking about herd immunity and going Sweden's way and having the exposure, but I've chosen to be cautious. So that's kind of a personal choice, I would say. As long as the online programs are helping kids achieve what they would mostly at school, I think it's better to wait it out a little bit more and see how things go before going back to schools. That's again, my personal opinion.
Okay, thank you, Sirat. And we might have some more questions later on.
Sure, I'll stick around.
Okay, thank you, Sirat.
Thank you.
And then we have Dr. Amit Rai. He's joining us from America. Thank you, Dr. Amit Rai, for joining us today. He is a nephrologist, kidney specialist. He completed MBBS from India as well. And right now he is in Albany, Indiana. Dr. Amit Rai, thank you so much for joining us. Just quick reminder, audience, if you can please fill up the Google form in case if you have any questions. And Dr. Amit Rai, can I have you here? If you can please unmute yourself and if you can help our kids to choose their careers answering these questions. Thank you.
Thank you, Jagru, for the introduction. Can everybody hear me?
Yes, we can hear you.
Okay, good. Well, like Jagru said, I did my MBBS from India in a city called Amritsar. So the medical college Amritsar, I did my MBBS. And after my med school, I worked there for a little bit. I did a couple of house jobs. One was in ER. I worked as an emergency medical officer in one of the rural hospital. And then I did a house job for a few months in pediatrics. And then I took my USMLE and then I came to US and then I started my residency in 2003. And I did my fellowship in the field of nephrology. And that was for 2 years. And since then I am in I'm practicing nephrology in a big group, and I practice in 2 states, in Kentucky but mostly in southern part of Indiana, in Baptist healthcare system. I guess I'll go through the question that you sent to me. That first of all, why I chose this career, or should I go with the format that I see on the screen?
As you wish, Dr. Amit.
Okay. Well, the growing up during my childhood in my middle school and all that, I did not have any clue that what I want to be. But as I was in high school, as probably a lot of you kids going through your parents telling you what to do and to go in the medical field. Similarly, my parents inspired me to pursue my career in the field of medicine. My uncle was a doctor, and he was an inspiration to me. And also during high school, I grew interest in biology more than physics and other fields. And I always wanted to help people, especially in the worst time of their life. So that was the main reason I wanted to pursue my career in the field of medicine. So that was the main reason. And during when I was doing my internal medicine, I grew interest in nephrology because we get to see the sickest patient in my field. And it's very rewarding when you can help people get better and decrease the suffering. So that was the main reason I chose this career. And in my typical day, I see patients in different settings, in the hospital, in the office, and in dialysis units. In the hospital, like Dr. Seerat said, it's a teamwork. I'm a consultant, so most of the time I am consulted for the patients who have kidney problems. And we work as a team, and we try to identify what's the reason for the patients having kidney disease or kidney problems, and we diagnose it and try to treat it with the medication, and in worst case scenario to do dialysis. And I see patient office settings, and obviously to diagnose then people with a new onset of the kidney problems or people who have already kidney disease. We try to manage several aspects of that. And obviously, the intentions is to help them recover their kidney function, and if they cannot, to prepare them for the dialysis. In the dialysis units, I see the patients who are already in the dialysis, whose kidneys did not recover or they haven't recovered yet, so they continue dialysis till the kidney function get better. Then the question was, what do you recommend to prepare for, if somebody wants to be in this career? This career, my job is, it's a hectic job, but it's a wonderful profession, I would say. The best part of this profession is, the personal satisfaction. Like Dr. Seerat said, when patients tell you that, you make a big difference in my life, or somebody saying that you made my dad better, he was about to die and you helped him. And this is that's the best part of my job, is the professional satisfaction. I would say that, the kids have to know during their high school years, if they see themselves in this profession. The working hours is a challenge, but still it's very rewarding, both financially and as far as personal satisfaction is concerned. Now, how do I decide about this specialty? Like I said, during my residency, when I was doing my residency in internal medicine, I grew more interest in the field of nephrology because I got to see the sickest patients, and it's very rewarding when you take care of them and get them better. And in my typical day, like I said, I see patients in different settings, in the hospital, in the office, in dialysis units. Half of my day I spend in my office, and the rest half of the day is divided between seeing patients in the hospital setting and in the dialysis units. Typically, I work between 8 to 12 hours a day, depending upon how many patients I have to see. And sometimes, if I don't have office, the day can be shorter. Any other question I can answer?
So can I ask you something, Dr. Amit Rai here?
Sure.
So again, the same thing, like I think parents are really, really worried right now, especially with the second wave coming. And recently, like I heard that in Ontario, there are a number of cases increasing, and especially this is a mother's group. We are helping our kids to get into different fields, and we always talk to each other and like getting worried that should we send our kids back to school, should we keep them home? So it's really hard for us to make that balance, because if we don't send our kids back to school, then it is like, I think they might have mental health issues later on, because there is no socialization and there is no one-on-one interaction. But at the same time, their health is the first or main priority for us, right? So even in America, I know that it is even worse than Canada. So what do you recommend in this case?
I think that's a very good question, but it's a very tough to answer question also. I have 3 kids. My oldest one is 16, he's in 10th grade. And the youngest one, she is 3.5. So my high schooler, so he's going 1 day a week physically to the school. And the only reason I chose to send him to school once a week because of some tedious assignments. He's very much interested in pursuing his career in the field of medicine, and he had some projects he didn't want to miss. But still, I had to teach him vigorously how to take precautions, keeping the mask on all the time, frequent hand washes, not to touch anything. It's difficult, but because he's a high schooler, he can better understand that. So I was able to send him once a week to the school for some assignments that he could not finish at home. So obviously my 3.5-year-old daughter, I decided not to send her to the daycare or the preschool because she won't be able to, take all the precautions. So you have to think about, how old the kid is and how much precautions he can take and what type of setting you're sending it to. So
that was actually my next question, that is there anything we can teach our kids, taking the precautions or the safety measures they can take, so that even though if they come in contact with someone who's COVID positive, is there any way if we can protect them in one way or other or help them?
Okay, the way I taught my high schooler that this is a virus. What we know, it's transmitting. It's an airborne transmission. That means a vector-borne. Touching something and you touch something, is not. We don't have that much data that's spreading that way. The main way of transmission is that it's airborne. So obviously you have to keep the mask on and the social distance. These are the two most important things. Now, like I said, so far we don't have that much data that it's transmitting very fast with the vector-borne. That means the fomites. That means if we touch something at the surface which is touched by the person who has the virus, we don't have that much data that's spreading that way. But still, it's better to take precaution. Try not to touch things, and wash your hands. Keep sanitizer with you in your pocket, and or soap and water, even better. And take, social distance is the key thing.
Okay. Thank you, Dr. Amit. That was very informative. And of course, the audience we have right now, it's 9 to 12 grades. So I think they can take those precautionary measures. And I just hope that everyone is healthy and safe. Thank you, Dr. Amit. We might have some more questions later on.
Sure.
If you can stay with us. Thank you. And then we have Dr. Suchi Talwar. Thank you, Suchi, for joining us today. Suchi, we actually all are so proud of you, your parents. We all are really, really happy that you finished your medical school recently. And I know that you are about to start your job now, right?
Yeah.
So Suchi is Doctor of Osteopathic Medicine. She holds bachelor degree in medical sciences from University of Lethbridge, Alberta. And then she moved to Ontario. And then she is specialized in family medicine. She has completed studies from Lincoln Memorial University, DeBusk College of Osteopathic Medicine. And this is what I really want to know, maybe more about osteopathic medicine from you, Suchi. Thank you once again for joining us. I do have some questions here, Suchi, if you can please help our students to understand what is DO, why did you choose it, and also if you can talk about your journey in the medical schools.
Sure. First of all, thank you for inviting me to speak here. From what I've gathered so far and all the information that you've provided, it seems like a great initiative. I wish I had something like this when I was in grade 9 or 10 and trying to make up my mind about what to do. So I'll start things in a little out of order, if that's okay. I'll start with my journey first so that that will help me sort of explain more about what a DO is. So I moved to Canada from India when I was in grade 9. And so, it was a brand new country, brand new schooling. I wasn't really aware of all the requirements or the prerequisites. So I was learning just based off of, what my teachers or what my advisors were telling me. And sometimes that information is, well, not sometimes, most of the time it's very, very helpful. And sometimes whatever they're telling you is just how much they know. So it's not necessarily a broad perspective or all the options that are available out there. So that's why my path sort of changed a little bit. So I did my bachelor's, like you mentioned, in Lethbridge, which is a small city outside of Calgary in Alberta. And so I was doing, my bachelor's there. And when you guys get into that stage, I know you guys are mostly 9 to 12, but when you get to that stage, when you're, in your undergrad and things like that, the pressure is on, because you need to have, everybody tells you need to have a high GPA, you need to have all the extracurriculars, you need to have all this and that. And so there's a lot of different things that you need to focus on at that time. So one of the biggest things was volunteering, which I'll speak about here later on, because that's one of my questions. But as I was volunteering and doing some observerships, one of the very new doctors in that city, in Lethbridge, was a DO. And so he was one of our family doctors, actually. My family started going to him, and I just one day I was intrigued, because, typically when we see a doctor's name or a sign on the window or the door, it typically says blah, 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 MD. And so I saw DO for the first time, and I wasn't sure what that meant. So I was just curious and asked him, and he explained to me that it's Doctor of Osteopathic Medicine, but I was still confused because he was a family medicine doctor. So I'm like, so are you different, or what is it? So then I got to observe him and what he was doing and how he was handling his patients and how he was trained was very intriguing to me. So essentially, osteopathic medicine is, if you want to think about it, it's we go through the same schooling, just like MDs, right? So we have DO schools and MD schools in the States. There's actually DO schools in the States, as well as Australia, I believe, are the two countries that have Doctor of Osteopathic Medicine schools. Most of the countries in the world, I think it's almost all of them currently, accept a DO just equivalent to an MD. And the ones that don't is only because they're not aware of it. It's not because of lack of training or difference in training. It's the same amount of training, same amount of med school, same tests we take, just like MDs. They have different names, but essentially it's the same training is what I'm trying to tell you. And then we just have extra 200 hours or so of musculoskeletal medicine and how to do manipulations and things using our hands. So the primary focus of osteopathic medicine, or a DO, is how to be able to connect with your patients using your hands, using your emotions, using your feelings, and then also just, focusing on primary care and preventative care. Those are the two big things. As a DO, you can go on to become a radiologist or OB-GYN or an oncologist, which is a cancer specialist. So whichever field you want to, it's just that your type of training or style of training is a little different. So of course, in Lethbridge, Alberta, Canada, we didn't know what a DO was. And so when I shadowed with him, just how he was able to approach his patients was eye-opening for me. So when I was applying to schools, I also applied to DO schools in the States. And so it's the same process, it's just a different application cycle or different application process than the MD schools. So I applied to all of them, and I got selected into a couple, and I had to decide, okay, so this is what I need to do, which one do I choose? And so it just, for some reason, just my personality or the way I approached things just gelled well with what a DO was. And so I chose to go to the Lincoln Memorial DeBuss College of Medicine. It's a huge name. I decided to go there in Tennessee. And so I finished my schooling there, and then I did my residency in family medicine. So again, I liked people, and I liked talking to, just families and knowing the entire family, getting in touch with their day-to-day life, and then actually figuring out how to make change on a small scale first, which actually has a bigger impact later on. And so that's how I chose family medicine. And like you mentioned, I just graduated from residency this past July. So this July that just passed, and I'm going to start my job in October. So that's sort of my journey. I hope I kind of answered what a DO is. I know it's a brand new topic. Maybe for some of you, maybe some of you are aware of it, because I know in Ontario, there are more DOs, and so there is a little bit more awareness than there is in other parts of the country in Canada. So you're more than welcome to ask me more questions or to go elaborate on that later on if you would like. And so the next question is, what can a student do to prepare for getting into medical school? So in terms of college classes, in terms of extracurriculars, all of that, right? So the biggest thing I want to tell you at this stage, in the high school phase, is to build your base as strong as you can. Dr. Seerath mentioned very good points in terms of, having good personality skills and all of that. All of that comes only if you're participating in extracurricular activities like volunteering, like sports, like all of that, right? Because more and more every single year, medical schools and even residency programs are looking at the overall applicant. They're not looking at, do you have a 4.0 in your BSc or did you have a perfect MCAT score? Those are definitely things they look at. I'm not trying to belittle their value, but I'm trying to say at your stage right now, the biggest thing you can do is just broaden your perspective. Get involved in things. It's a debate club, sure, go join it. It's some types of sport activity, go do it. It's not just about the books or the studies. It is about that, but they're what a doctor is, and you've heard that from all the people who talked so far, that their lives are so busy and they have to multi-manage so many different things in personal as well as professional lives. And so that's what the schools are looking at now. Can you manage different things together while you're in high school or in your undergrad? So if you're able to demonstrate that, that's great. So the way I approach things, or the way I tell people, is make sure you do something that's, social. So what that means is, like, whether it's volunteering at a church or temple or whatever it is, and then also do something that's athletic. So if you are more that kind of person, go get involved in that, right? So broaden your perspective as much as you can. That's the biggest thing you can do. In particular, to prepare to get into medical college, you have to take classes, especially during your senior years, that build your base. So whether that's statistics, whether that's anatomy, if that's offered in your school, whether it's biology courses or physics courses, like science heavy courses, because that's what you're going to do in bachelor's. And then the other thing that's really important in the high school phase is that you need to get involved in certain things, like French speaking or Spanish speaking, whatever, like different languages, because again, that will build your profile in terms of, okay, you can do this, this, and this. I might sound like a checklist type of person, but I'm only saying that because that's literally how they're looking at applications these days. But of course, do something for fun. And then the other thing, which kind of ties into the next question, is, because I sort of answered the extracurriculars, is that it's not the amount of activities that you're doing necessarily. It's also how long have you been committed to a certain activity. So if you did volunteering at a hospital for 2 days or 2 months, that's not as impressive or as important as you did 2 hours a month at whatever hospital for volunteering, or, for 4 years. And so ever since high school, you got involved and you only did 2 hours per month, or even 2 hours every other month or something like that, but you were committed to that same thing for 4 years or something like that. That speaks volumes in terms of your commitment, and that you can manage things other than just studies, because really you need to have a full application.
I think that's a very important point, actually, Suchi, you made there, because I know some students, they start volunteering in the hospitals just to get 40 hours to complete their high school volunteer hours, right? Yeah. So that's a very good point you're throwing at them. They all need to understand this. It's not the number of how many hours they're working there. It's basically how long do they work there, right?
Exactly.
Thank you so much for that. Sorry to interrupt you. Yes,
no, that's okay. I think, so I've hit most of the important points. There was one that said demonstrate personal qualities in medical schools and doctors. I think I've hit on that, really, is that you have to be personable. You have to show that you are somebody who can interact well with others, not just for the applications, but also to figure it out for yourself. Do you even like being around people, right? Like if you're choosing a profession, especially health sciences, no matter what type of field you eventually go into, within health sciences, it's all a people job. So you need to figure out, are you a personable person? Do you like hanging out with people? Do you like doing things when the other person may be a little bit rude or mean? Are you okay with that? Because at the end of the day, you're getting the satisfaction that you need from your profession. So things like that. Those are some of the qualities that I think are important. And then we'll get to the last question, which is, how does a DO compare to an MD, which I've sort of answered before, but again, like I said, if you have more questions on that, please feel free to contact me. I'll give you a little bit more about what a DO does, or the application process for it. So like I said before, there are, I think if I'm not mistaken, the last time I checked, there's about 32, but it could be a little bit more than that actually, because there's new schools building up all the time. So there's a lot of schools here in the States that are osteopathic medicine. It's different, so just be careful when you're doing your research. It's different than an osteopath. So in Canada, when you say, oh, I'm an osteopath, they are typically equivalent to chiropractors. So they're not doctors of medicine. They're just, you know, they are manipulative skills people, and that's their scope of practice. A doctor of osteopathic medicine, like I said, is doing everything, like in terms of, I'm a family medicine doctor now, so I'm a DO, but my colleague, all the people that I did my residency with, some of them were MDs. I can practice and do everything that they can. But if they need help with back pains or shoulder pain, and now they have knee pain and they don't know what to do, so the MDs will refer them to me sometimes for manipulative skills. So I hope that clarifies things. Not all DOs choose to do the manipulation part of things. Some people don't elaborate on that and don't specialize in that later on. Some people like me who want to go into family medicine or preventative medicine, we keep those skills and we do keep on practicing those. So that's really the difference. But once you specialize, whether it's internal medicine, whether it's cardiology, whether it's rheumatology, you can do everything that an MD can. And if I wanted to come back to Canada and practice, all the states are taking it. First of all, that we don't have to take any special exams if we come from the States to come up to Canada. There's some states that there's still not as much awareness, so there is still that extra step that you might have to get extra certification or clarification and things like that. But like I said, it's not because of lack of training or difference in the degree name. It's mostly because they're not as aware. And so as more states and more provinces, sorry, I should have said provinces, are becoming aware, they are opening up their doors for DOs. So I hope that answered some of your questions. I know that was a lot. So if you have more, please feel free to ask.
Absolutely, you did, Dr. Suchi. Thank you so much. That was very informative. And our students might have some more questions for you later on, because as you just finished the medical school, so they might want to ask you a few more questions later.
Sure.
Thank you once again. And then next part is talking about the registration for Future Healthcare Professional Program, and I will ask Komal to take over from here. Komal, this is all yours now.
Yep, give me a second.
Yep.
Hi everyone, it's Komal again. So in the next couple of slides, Anika, Suprit, and I will go over the registration process for our Fhp program, signing into our specific learning management system. Here we go. And finally, registering for Hosa through CKSTEM's chapter. And again, if you require like any future assistance or didn't catch something, you can always refer back to this video as it's being recorded. And you can also DM us on Instagram at ck.stem or email us at info@competitivekids.org. Again, this presentation will be made available to everyone through our website, so you can definitely click the link when you have access to the slides. Until then, you can go to ckstem.org/FHP and click on the first orange button that shows up that says register now, and it'll take you to this Google form. So from there, filling out the form is pretty self-explanatory. Just follow all the prompts and answer all the questions appropriately. So a key point is that registering for the FHP program is a two-step process. So the first one was filling out the form, as we just went over, and second would be paying through our website. So it's the same URL, ckstem.org/FHP, and you would have to scroll down to where you can see fee payment. And this course is only $150, which with 16 sessions, it really calculates to less than $10 a session. And that's including the practice questions that we provide for you as well. As a nonprofit organization, we have to meet our costs, and this is kind of like our way to do so. As well, all of our instructors are medical professionals, and they're generously donating their time to make our vision a reality. So now that we went over the registration and fee payment and everything, I'm going to pass it over to Anika, who's going to talk more about our learning management system.
Thanks, Komal. So, hi everyone, and as Komal mentioned, I would like to talk to you guys about our learning management system, or our LMS. So you can find this at the link you see, learn.ckstem.org, and when you sign up, you do have to use a Gmail account for this, but once you fill out the registration form and you do the fee payment, as Komal mentioned, we can go into that again and send you an email on how to do that. But what this is basically the platform that has all of our content, practice questions, class recordings, and other resources you might need. If you've ever used Google Classroom or Brightspace before, it's similar to that, but it's a lot more interactive, and this makes it easier for our mentors and different teachers to interact with the students. This also has all the quizzes and mock tests that will be administered, and it's such a cool website. I'm so excited for you guys to see it. So let's move on. Secondly, I want to talk to you guys about registering for Hosa. And before we get into that, I know there are a lot of grade 9s and 10s here. So I want to talk to you guys a little bit about what Hosa is. So Hosa is a competition or a conference for high school and university students that helps them explore more into the medical field or the health sciences field as a whole. There's a lot of different events that you can look on their website, such as biomedical science, medical terminology, dental science, as the group was mentioning earlier. So you can all take a look at that when you want to. But for those who are returning or those who know the process, the registration has changed a little bit because of Corona. In the past, there would be the one conference called SLC, or the Spring Leadership Conference, happening in early or late spring. And then there would be ILC, the International Conference, happening in June. However, this year there is no international conference, and there are two conferences instead. One of them is the Fall Leadership Conference, which is going to be happening on the first week of December, and the second one is the same SLC, happening in late spring. So to actually register for Hosa this year, you do it on your own rather than through your school chapter. So you have to go to the website and go to hosacanada.org, select the registration button in the right, and you have to just follow the steps that are listed there and make your own account. Now, to highlight some key parts when actually making your account, I'm going to pass it over to Supreet.
All right, thank you, Anika. So now I'm just going to say something very important when you're registering for Hosa. Please pay attention to this. When you're registering for the Hosa and creating an account for the membership, you need to make sure that you select the chapter, school chapter, as Competitive Kids STEM. Because if you do not select it as a school as Competitive Kids STEM, then you will have trouble with participating in team events. And actually, if you go through the link, it's already in the drop down. However, if you think of changing the name to your school account or something, it won't help you to participate in the team events. So please note that it's very important for you to select Competitive Kids STEM as your chapter, not any other school. Now I would like to pass back to Ms. Chair.
Thank you, Supreet. And then this is the time for question and answers. If we have any questions for our guest speakers, Anika, Supreet, and Komal, if you can help me if there are any questions for our guest speakers. Our guest speakers are here to take those questions.
Sure, so we'll just go in the order in which they presented. So I believed first was Mr. Bipin.
Dr. Bipin, but he left early because he had to start the class. So we can take his questions and get the answers. We can post it later. So the next was Dr. Sirat. So we can have questions for Dr. Sirat now.
Okay, I think Komal is taking over the questions for Dr. Sirat. So she will do that.
Do we have questions for Dr. Sirat?
Yep, let me just look at that. So a question from Arti. She's asking, what did you do in order to get accepted to a medical school in Canada?
Sirat, are you there? Dr. Sirat, are you there?
I am here. So yeah, that is an important question for people who want to come back to Canada. For me, it was luckily a program they called the Pathway 4 at the time. So essentially what I did was I applied to the College for Physicians and Surgeons of Ontario. It's a big application. You kind of do all their requirements. They go over it and they let you know if you can practice supervised in one of the hospitals or clinics or whatever your area or scope of work is for about a year, and then they will assess you on site. So I had job offers from a few hospitals. I picked up one. I ended up working there for a year with a supervisor who was kind of loosely following you. You were doing your independent practice more or less, but they would go over some of the charts from time to time. And then you talk to the college again at the end of the year. They send a person to assess you or your practice on site. And that process kind of took me another 6 months, I would say, for someone to be willing to come there and do it for me. And then it does come at a cost. So it wasn't cheap. I think it was a good $6,000 to $8,000 in all. But again, I didn't have to go to another med school. I didn't have to take any exams. I'm not sure if the Pathway 4 is still working. If it is, I hear that it had become quite competitive in the last few years. So a better bet might be to take the Canadian exams, really. I know of some people who did that and then were practicing in Nova Scotia for a while and then moved to Ontario. But they did their royal, like the college exams. That's another way.
Thank you, Dr. Sira.
Yep, the next question is actually for Dr. Sheth as well. So someone was asking, someone wanted to get in contact with you. How would they be able to do so?
Okay, I can pass along my phone number or my email. Your group has those. And if you want, you can pass them along and they can get in touch with me.
I say if you can contact me, I can pass the Sirat's information with you. I can share it with you, and then you can contact Sirat.
So whoever asked this question, I think it was Jasleen. If you could message your group like on Zoom itself, that would be best, and we can get to it later.
Or maybe I can send you my email. If you can email me, and then I can pass you Sirat's information. Thank you. Any other question, Komal?
For Dr. Sirat, no.
Okay, thank you. It was good being here, and thank you for giving me the opportunity. You all have a good evening. Bye now.
Thank you.
Thank you. Thank you.
So our next question is for Dr. Amit Rai. So our first one is, what extracurriculars would you recommend for a high school student pursuing a medical field? And do you have any other tips? Oh, sorry, hold on, let me unmute you.
Dr. Amit Rai. Thank you.
Can you hear me now?
Yeah.
Yes, we do.
Okay. I think that's a very good question. You know, there are a few things you can do. I think Dr. Suchi explained it in detail. And one thing I would add is the research activities. If during your high school years, if you can involve in some research activities, where I live, we have a University of Louisville here. They have a lot of research opportunities for the high schoolers. What they do is, you know, to collect the data. For example, if it's a research involving effect of cigarette smoking in different aspects of the health, and the data is already available, they just have to collect and file the data to find the conclusions. This type of research. So this is just a bench research. Clinical research will be difficult to find at your age, but collecting data, that type of research you can be involved in. Second thing, doing a volunteer job in the hospitals, it counts a lot, especially in the US, it counts a lot. For example, doing some volunteer work in the nursing homes, taking care of the elderly. These days, it's not possible because of the COVID and so much restrictions, but in general, if you can do volunteer job at those places like nursing homes and some pediatric units. For example, I have seen in the hospital at work, some high schoolers, they come for, you know, to help in pediatric wards. For example, the kids who don't have any infectious etiologies, they come to read books for them and helping their parents getting some stuff from the outside. So this type of volunteer job, it just shows your motivation to be in the healthcare field and helping other people. What else? And doing some observership if you want to rotate with a doctor of your choice in different specialties. If you want to rotate, do some observership to see what type of settings they work in and what type of patient that they see. If that intrigues you, that'll help too. And one thing is that during summertime, if you can involve in some summer schools teaching some biology projects like genetics, marine biology, and things like that, that also matters.
Okay, thank you. So there's a couple other questions for you. Our next one is, my uncle is a urologist. How is that different from a nephrologist?
Okay. Well, I have been asked that question, especially by my patients. So let me tell you what I'll tell layman, how to answer this question to a layman. So you see a motor and a piping going to the motor. So one is a plumber and another is an electrician. A urologist is a plumber and a nephrologist is an electrician. So what I do is, you know, I study the people who have kidney disease, what's affecting their kidneys, and how do I treat medically. And a urologist, like a plumber does, they deal with the plumbing. For example, if they have stones, if I detect a patient who has a mass on the kidney or cancer in the kidney, I will ask the help from the urologist to take it out, to remove surgically, whether to take the whole kidney out or just take a tumor out or just take the stone out. So they deal with the surgical aspects of the kidney disease, and I deal with the medical aspects of the kidney disease. Does it make sense?
Makes sense to me.
That
So
was so well explained, Dr. Amit. Thank you for explaining that.
So one last question. Someone was wondering if you are interested in the entire human body compared to one specific part because you specifically chose nephrology. And if so, what career/branch should we follow to work in an area where we learn and interact with the entire human anatomy?
Can you repeat the question?
Sure. So they said you chose nephrology as your career compared to any other branch. And they're wondering if you are interested in the entire human body compared to just one specific part. And if you are interested in the human body as a whole, what career or branch should you follow or kind of go for if you're interested in something like that?
In med school, you do your residency for 3 or 4 years, depending on which residency that. The family practice residency in the US is 4 years, and internal medicine is 3 years. So during my internal medicine residency, I like to take care of the people with kidney disease electrolytes disorders, how to take care of hypertension or high blood pressure, how to take care of the people with the acute kidney failure or chronic kidney disease, different aspects of the dialysis. And I was intrigued by the kidney transplant patients, taking care of the people who have kidney transplants or people who need kidney transplants. So it all depends on your interest. I practiced for a little while in India also, and I want to do internal medicine for sure. But at that time, I didn't know what specialty I will go into. But it all depends on your interest. In another field is neurology or neurosurgery. That also very intriguing specialty. But it all depends on your interest.
Right. So is there a career or a branch that has everything in the human body? Like,
okay. So what Dr. Suchi Talwar, what she practiced, it's more like a family medicine, that you see the patients of all kinds. So if a person who's practicing family medicine, they will also see the patients. They will first of all manage the patients who are common things like high blood pressure, diabetes, but they will also see patients from gynecology aspect and a little bit of endocrinology, managing the diabetes, and to limited extent gastroenterology. They can do minor procedures also. So staying in a family practice, that gives you exposure for all kinds.
Right. Okay. Well, thank you.
Thank you, Dr. Amit Rai. Do you have any other questions, Anika? Any more questions for Dr. Amit?
I don't believe so.
Okay. Thank you, Dr. Amit. I really appreciate your time. Thanks for making it happen today.
No.
So next we're going to move on to Dr. Suchi. And our first question for you is, was it hard to transition from a US school to getting into a Canadian residency? Because I've heard it's hard to come back to Canada and find a residency placement.
So that's a very good question. Just to clarify, I did not come back to Canada for residency. I was still in the States for residency, but I will speak about, I know the process because I looked into it, so I can speak about that for a little bit. So essentially, once you're in so let's say you do medical school in the US and you want to come back to Canada for residency, you have to be proactive about it. So I knew from the get-go that I was okay doing my residency here in the States. So I didn't really pursue the pathway to come back into Canada. The way to do that is, so right from first year of medical school, you have certain tests and things that we have to take for the US side of things. It's called the USMLE. I believe Dr. Seerath mentioned that before as well. So you have to take those, but then at the same time, Canadian boards or Canadian qualification exams. So some of them, it's called LCME or MCQEE, I think is what it's called. So essentially from the very beginning, if you know that you want to come back to Canada, it's the same curriculum if you think about it, right? It's the same type of questions, it's the same type of knowledge that you need to know. So once you're preparing for one, just take the other one as well at the same time. So a lot of my colleagues who went back to Canada to do residency, that's what they did. They would just take the two exams together. They will just schedule them, a couple weeks apart, just to get used to the format of the Canadian exams as well as the US exams. So if you're doing that right through medical school, you don't have to waste extra time at the end of medical school and go back to review, old things that you might have forgotten. And so that's the part that's hard about it. Most people that say that it's hard is because, you have to go back and do all the theory part of things again, which can be very difficult. But if you know that from the get-go you're coming back to Canada, just take your exams together simultaneously. It is definitely more competitive as an international grad to come back to Canada and match into a residency program. But I say international versus like a US graduated. So there's still a slight difference with that. But regardless, Canadian residency programs are very competitive in terms of letting people come back to do the residency here. So I would actually personally suggest, if you want to come back to Canada to practice, don't come back for residency. It's just a harder process. It's more competitive. There's very limited spots for residency anywhere, whether it's the States or Canada. So they typically want to train all the medical students that they just, graduated. They have to have a spot for them. So it's hard for them to give away spots to people coming from outside. So I think it's easier in a way to finish your residency in the States if you did medical school in the States and then come back to Canada. Because then, like Dr. Sears mentioned, there's different pathways, the pathway 4 that she mentioned, and there's, different other pathways as well. So you can qualify and come back into Canada that way instead of during the residency part. I hope that answered the question.
Yeah, no, that made complete sense. Thank you.
Yeah.
Another question is, are there a lot of exams you have to do when you come back to Canada, not just as a DO, but also for MDs?
So yeah, so there's in the US, so I'll just give you an example. So the answer to a lot of exams, just be prepared if you're going into this profession, you're going to be taking exams for the rest of your life, first of all, because at every step, they want to make sure that you're prepared to take care of human life, right? So it's very important. Even, once you've graduated, so I've graduated, I still have to take my, there's a final boards that you have to take in order to get your license. And then after that, there's every 10 years, you have to recertify and take exams. So be prepared to take exams, first of all. In terms of, do you have to take more exams to come back to Canada? So when you're in the US and training here, there's USMLE step 1, step 2, step 3, okay? And in Canada, they have equivalent things. So they have, for step 1, they have one part, then they have a part A and part B, I believe, for the practical part of things, where it's more like the clinical things. So if you have already completed residency, right? So you've completed your training, your postgraduate training, you've completed residency, not just medical school. Then to come back, there's ways that you don't have to take certain exams, and you can just you can practice or practice supervise. It's like partially supervised practice and things like that. That's pathway 4. But if you want to just do it right away, there's ways you can just take those last 2. You don't have to take the first theory part of things. You can just take the clinical part of things and do that. But it's very specialty specific. So I won't be able to answer for each specialty what exams you have to take. For family medicine, for example, as you all know, there's definitely a need for family medicine doctors or primary practice doctors in Canada. So they make things a lot easier, right? And then even for internal medicine and things like that, it's easier, for example, than certain other specialties. I don't want to speak out of turn. So if Dr. Seedorf knows more about that, so maybe she can comment on that later. But really, it's just, you have to take exams, but you will be able to get there. And once you have trained in residency, then it's not as many exams as there are if you wanted to get in during or after medical school for residency. So for residency, definitely you have to take all of the exams. After residency, most specialties, you don't have to take extra exams, but for certain ones, you do.
Okay.
Thank you, Dr. Suchi.
So
Any other questions?
There's one last question for Dr. Shuchi. I dream of being a geneticist. Are there any tips you can give me on what to study specifically or what career to go into?
That's very cool. So geneticists, and they're in grade 9 to 12, I believe. Is that?
Yeah, they're a high school student.
Okay, so I would say that currently, like if you like that field, I would say definitely focus heavy on your chemistry, your biology, science heavy topics for right now. And then once you are in bachelor's, that's really when, or your undergrad, that's when your focus needs to be really on, biology heavy courses. So there's biomedical sciences, there's bioengineering, there is just general health science minors in certain universities. So I would say definitely do your research early on when you're trying to get into your undergrad, because with every year, there's more and more specialized programs for undergrad that certain universities are offering. Okay, so especially in Ontario, I know there are certain universities that are offering very specific biology heavy courses. And so you can choose those either as part of your broader BSc, which is Bachelor of Sciences, or you can focus in and choose that as your major or minor or something like that. So I would recommend, doing your research at this stage, looking out for that. And then the other thing also would be to look for which university or which college is going to have research related to that. So what type of research is going on in, I don't know, University of Toronto versus McGill, right? So what do you want to do in terms of genetics, and which university or which college is offering that kind of program, so that in the future you can get involved in that and then advance your career that way. In terms of what tips I have other than that, I don't really know. I think, just really making sure that you're proactive with all the other things that I had mentioned before. It's a very neat career, definitely in demand, I would say that. Biomedical engineering is definitely an up and coming field. So that if that's something that you guys are interested in, that's huge. I know through not just the health sciences pathway, but also if you just went into the engineering pathway and then went into biomedicine, both ways, like through both aspects, it's very high in demand. So I think kudos to you for choosing that. It's a very up and coming field.
Perfect. I think Anika missed a question for you. So the question is, do you have to have a specific undergraduate degree to apply to a medical or any other postgraduate school?
No, actually, I know. So it's a misconception. We think that you have to have a BSc or a Bachelor's of Science in order to go into medical school, which is actually not true. You need to have certain prerequisite courses is what it is, right? And so what that means is you could be, even though it's very hard, but you could be a arts major in college or in university and still do your biology courses, and I'm talking about university level here. So you could do your biology courses, your physics courses, your chemistry courses, everything that's required by medical school, and still go into medical school. So you don't need a specific undergrad degree to get into medical school, okay? The reason I say it's hard to do that if you're anything other than Bachelor's of Science is because with every major, right? So it's called major when you're specializing in a certain thing in undergrad. With every major, you're going to have their own program specific requirements. So you're going to have to take certain, sociology courses or certain physiology courses or certain anatomy courses. And then on top of that, you have to make sure you meet all the requirements for the medicine part of things. So when I think at your stage, especially when you're more into your grade 11, grade 10, 11, late grade 10 years, make sure that you're researching which bachelor's program you want to get into, but then also keep in mind, okay, which medical schools am I going to be applying to? What are their prerequisites? Just go on their websites or Google their things and then see, okay, what are medical schools really looking for? And so you'll see a variety of different things. It's not just your biology courses. It's a bunch. They definitely need English. They definitely need certain statistics courses. They definitely need math. So all of those variety of prerequisites courses that you need, take a glance at them at this stage before deciding your bachelor's program. That gives you a hint. Okay, can I do a minor of biochemistry or major in biochemistry and minor in, I don't know, physics, or a minor in math? Yeah, it's doable. Just make sure that you're able to meet your prerequisites.
Okay.
Yeah, I think that wraps up all the questions.
Any other question for Dr. Suchi?
No, I think that brings us to an end of all questions.
Okay, thank you. Any question on FHP? Supri?
We do have one question.
Mm-hmm.
It's asking that, are we going to have all the specialty learning through the session?
That's a very good question, actually. Yes, because we are going to talk about all body systems. So we're going to talk about digestive system. We're going to talk about nervous system, cardiovascular system, renal system, excretory system. So when we talk about these body systems, I'm also going to talk about what is normal, or what how the system works when the person is healthy, right? Which is called physiology. And I'm also going to talk about what is pathology in that particular system. That being said, like, what if person has some diseases in the heart or some diseases in one particular system, for example, digestive system, right? So when we talk about anatomy, pathology, we are also going to talk about the different professions in those body systems related to each body system. We will be discussing the professions as well. So in each session, we are going to discuss 1 or 2 professions related to the body systems we are discussing here. Okay. Is that the question was asked?
Yes.
Super, take a look. There's another question.
Is there any other question? Yeah.
Super, or do you want me to read it out loud?
So there is another question asking that, are we going to get credit for this course?
So no, this is not credit course. But as I said earlier, we are preparing you for competition. So you will go in competition. So for that, you will get certificate for sure from Hosa or other competitions you participate in. And that will something go on your profile or on your resume, right? And as all the doctors were saying, that it is not just that academically you're really strong or getting A's or A+ in your courses. It's also that you widen your horizon and see that what are the other areas you can get experience. So basically, when you go for these competitions, that will add up some value on your resume when you apply to universities.
And just to add really quick, for Hosa, you get a certificate if you place in the top 10 of your event. So that's kind of the thing that would go towards your resume, other than being able to state I've been in Hosa and I've done this event.
Yeah.
You also get a certificate from CKSTEM, so for completing the program.
Yeah. But again, this program will not give you the credit, but you will get a certificate that you completed program with us.
And that will help you with future biology classes.
Absolutely. Any other question we have here? Supreet?
No, that's it.
Okay. Thank you so much, everyone, for joining us today. Special thanks to our guest speakers, Dr. Suchi, Dr. Hamid, Dr. Bipin Shah, and Dr. Sirat. Thank you so much for joining us today. And audience, really appreciate for your time. Thank you for joining us today. Just a quick reminder, we are going to start these classes from October 13, every Tuesday, starting from 5:30 to 7. Hopefully, I'm going to see you all. I'm going to teach those classes. Actually, very excited to start those. Okay, so see you all on October 13th. So please make sure that you register for those courses, as Anika, Komal, and Supreet showed you that how to register it. And the course will start on October 13th. Thank you.
Yeah, if you have any questions, feel free to email us. The email is on the screen right now, or you can DM us on Instagram at ck.stem.
Absolutely. Thank you for reminding me that, Komal. And I think, Anika, someone was asking Dr. Sirat's information, personal information. If I can get that person's, maybe if you can get the email, I can email them Dr. Sirat's information to them directly.
Yeah.
Okay.
Right. Thanks, everyone.
Thank you.
Oh, sorry, we have one more question for FHP.
Yeah.
Is this the first session of classes, or do you plan to have more classes in the winter?
So we are going to start classes from October 13, and it is going to be for 16 sessions, but we do have the winter break. Okay, so we do have first session starting from October 13 till mid of December, and then in January, mid of January, we will be back. But again, this is the part of 16 sessions. It's not divided into 2 separate parts. When you're paying $150 for 16 sessions, it is including the winter session as well.
Yeah, so it's kind of split up into 2 before FLC, because that's the first week of December. And then we have a little break for winter break, summatives, etc. And then we kind of go on to
we start back in January. Absolutely. Any other question?
Sorry, could you clarify what you mean by, is there another option to join again?
There is any other option to join again? Are you showing me something?
No. Someone's asking me.
Oh, okay. I thought you were asking me.
No. They asked me if there's another option to join again, but I'm not sure what that means.
So we are going to share this recording with you all, as well as you can get the information by emailing us too. Okay. And just a reminder again, October 13, make sure you register before we start the classes actually on October 13. Okay, thank you. Any other question before we finish this call?